Afternoon. This is Dr. John Bennett from Miami, Florida. We're broadcasting another show with Donovan Christie, MD, doctor from Atlanta, with a background in internal medicine and pediatrics, as well as a fellowship in anti-aging. Today, Dr. Christie is going to talk about andropause, and we have the host, Mohammed Saleh. Good afternoon, Mohammed.
Yeah, good afternoon, Dr. Bennett. Thank you, and welcome, Dr. Christie. My name is Mohammed Saleh again, and it's a new episode of about andropause. Welcome, Dr. Christie.
Thank you so much, Dr. Saleh and Dr. Bennett. It's a pleasure to be here to talk to your audience.
Can you tell us a little bit about your background, Dr. Christie?
I am an anti-aging expert. I trained through the American Academy of Anti-Aging and Functional Medicine, and I've been practicing anti-aging medicine for about 12 years.
I will search for an answer to
I am certified through the allopathic board through internal medicine and pediatrics, and I've been practicing for about 25 years, all combined.
Well, welcome, Dr. Christie, and it's a pleasure having you today.
It is a pleasure to certainly be here. My earlier talk, I spoke about women, and as they go through the changes of life, the hormonal changes that take place that contributes to aging. A woman would go through menopause, it's called, and she would lose her hormones, sex hormones would go down. But what I introduced was that most hormones go down with aging. And it entertains the possibility of what occurs first. Do you get old and then your hormones go down? Or your hormones go down and then you get old? Well, the Anti-Aging Institute, we believe that if we keep our hormone levels at a healthy level, one that of someone in between the ages of 30 and 40 or 25 and 35, without exceeding the levels to supernormal levels, that you can maintain your function, your educational, your psychological functions well into your 80s and possibly even your 90s. So what I'm going to talk about today, I'm going to talk about the men and what happens to men. We call this male andropause or male menopause, and I'm going to pretty much discuss why it's important to keep a man's testosterone level at a healthy level throughout life. So my objectives then are going to be, what is male andropause? I'm going to define that for you. And then I'm going to talk about what hormones affect aging, the many effects of testosterone in a man, the different types of testosterone replacement therapy, and then obviously some natural remedies for andropause as well. So without further ado, I will start. So what happens in puberty? What differentiates a man from woman is this level of testosterone. The male testicles makes androgen hormones. It has two functions, basically. It makes sperm and it makes testosterone. Testosterone makes us uniquely male. A level of testosterone in a man is about 100 times the level of a woman. So while a woman, if she's getting replacement, will get about a half a milligram to 1 milligram, a man will get between 50 milligrams and 100 milligrams per day. So the androgens are hormones that define masculinity and are made in the testes, as well as trickles of it is made in the adrenal glands. And during puberty, that hormone, increased production, gets turned on, and it causes hair growth. Pubic hair growth, your gonads, your testicles grow, your penis grows. you get increased muscle mass, and the voice deepens. You also get sperm production. Testosterone is the principal androgen hormone, but you have others that you should know about. DHEA is classified as an androgen. It is the precursor to testosterone and dihydrotestosterone. It is also the precursor to estrogen. Between DHEA and testosterone is a hormone called androstenedione. It really is just a precursor hormone. It really does not have high levels, but DHEA has to turn into androstenedione before it goes on into testosterone. So what happens to a man as he grows up? That was puberty. His levels go up. He's very virile. He lifts weights and his muscles starts popping from his chest, his arms, his legs. And then something happens. Right around the mid-30s to early 40s, the hormone starts to decline. And what you notice is that his physical activities or his physical abilities starts to go down. He can no longer run as fast as he can. He cannot longer, his endurance is less, his sexual function is less, and cognitive function goes down. He notices now that he can eat the same amount of food, but now he's getting fat. He gets increased abdominal fat. His muscle mass has gone down, and he becomes a little bit more frail. He has a feeling of, not that feeling as though you can conquer the world, but more of a passive feeling. And he becomes depressed. Many men will be depressed. There are testosterone receptors in the brain, and the heart, and the bones, and the muscles. And it's very important because testosterone improves oxygen uptake. It helps control blood sugar. It regulates cholesterol. It maintains the immune system. And it's important for bone density. The red blood cell production, which when I talk about side effects, that testosterone is like EPO or erythropoietin, which causes the bone marrow to produce more red blood cell. It also impacts the heart. It's like an inotrope. It increases the contractility of the heart and strengthens the heart because it's a muscle. The heart's a muscle just like your leg muscle or your bicep muscles. So it strengthens it and it makes it more muscular. And then, it's also important for your neurological functions. So when these levels drop, the traditional approach is to say, well, I'm just getting old, and just move on. Anti-aging doctors don't believe in that, so we try to restore it. Male menopause, what's publicly known as low T, it's less sudden in onset than female. You don't see men going around fanning themselves, complaining of hot flashes or night sweats. But it's just as severe in long-term problems. It increases the aging of the heart. Low T does. It increases the brain aging. You lose your drive and your competitive edge. You no longer want to compete in that aggressive manner. You'll compete, but you're just not going to be as aggressive about it. The muscles get more stiff, and you get some soreness in your muscles, and you get a general fatigue and irritability. Oftentimes, some of my patients would complain about being irritable and not really know why they're irritable. But low T goes along with higher levels of estrogen, and estrogen is what creates that passivity in men and irritability. And what happens with that is, as your abdominal fat increases, the enzyme aromatase increases, which converts your testosterone to estrogen. So andropause then is a deficiency state, and it's lethal. In 1990, there was a study where they looked at men, 50 to 70-year-olds, And what they noticed was that when they checked these men between 50 and 70, they recognized that their level was about half of what it is for men between the age of 20 and 40. So what is happening? Is aging caused by the reduced production of the hormones, or the other way around? If you keep the levels high, will you age as rapidly? It's a very important point in anti-aging medicine. Andropause increases diabetes, brain dysfunction, heart disease, fragility syndrome, bone fractures, and the risk of cancer goes up. So testosterone to men is like, and this is what I say a lot when I talk to my patient, it's like testosterone to men is like milk to a baby. That's how much we need it in our system. So the data shows that the symptoms are correctable. Middle-aged men can experience depression, fatigue, abdominal weight gain, alteration in their mood and cognition, decreased libido, ED, prostate enlargement, and heart disease. Onset early 50s, earlier in men who smoke. Doctors can prescribe multitudes of medications for the above. They'll prescribe medicines for erectile dysfunction. They'll prescribe medicine for weight loss. They'll prescribe medicine for depression, antidepressant, and other drugs, when the underlying problem is the fact that they now have a low testosterone level, which needs to be corrected. Let me get back to the estrogen effect. Yes, men do produce estrogen. Estrogen increases with age as testosterone decreases. Estrogen causes low libido, and it's through the aromatase enzyme that converts that testosterone to estrogen. Estrogen will increase the risk of heart attacks and stroke in men. So unlike men, women that have estrogen and progesterone in a balance, when we get high estrogen as men, it's going to increase our risk of heart attacks. Estrogen also stimulates the prostate and causes prostate swelling. Not testosterone. Estrogen does this. Estrogen increases emotionality. What I ask men, I said, so when you go to a wedding, or you see a sad movie, are you crying? Do you get teary now? And many of them will say yes. And that has to do with an estrogen level of greater than 30. Testosterone on libido. Sexual stimulation starts in the brain. Free testosterone promotes desire and performance, sensation and fulfillment. The testosterone that's swimming around in the blood that's bounded to sex hormone binding globulin, that's not free. It needs to be dispersed from there. Estrogen will increase the sex hormone binding globulin, thereby tying up the testosterone, rendering it really not functional. So the testicles, as the man gets older, will atrophy. Just the same way, some fats will migrate in there, and it will not work as well as it did in your younger years when it was putting out lots of sperm. And there's two sections of the testicles. One section, seminiferous tubulus, is responsible for sperm production, and then the Leydig cells, that's what's responsible for the testosterone production. So what you need to know is that the pelvic region is packed with testosterone receptors. And then testosterone conversion into estrogen and dihydrotestosterone will increase with age. Now let's talk about testosterone in the prostate gland. This seems to be a big controversy where, men who've had prostate cancer, they're afraid to take testosterone because they're afraid that the testosterone is going to cause or somehow restart their cancer. If they've had a prostatectomy, there's absolutely no risk of taking testosterone replacement. If their cancer has been treated, testosterone will not cause prostate cancer, and it has never been shown to do that. Estrogen, on the other hand, has been shown to bind to sex hormone binding globulin in the prostate, which causes the growth of the cells. Most men with benign prostate hypertrophy, BPH, have low T. Testosterone does not cause prostate cancer, and I repeat that. But if you have cancer, if the cancer is active and it's there, you wouldn't want to put someone on testosterone because it will cause, it's a growth factor, so it will cause cancer to grow. But it does not. It's not the culprit. 21 out of 25 studies confirm that testosterone does not cause it. So most men should get their prostate health index checked. They should get a digital rectal exam and an ultrasound annually in men over 40. Most recently, the U.S. Preventative Task Force has come out and they've recommended not doing PSAs. The prostate health index is a test that takes into consideration the free PSA levels, which is somewhat of a better predictor of prostate disease than just a regular PSA, because PSA can go up in many benign conditions, particularly prostatitis, inflammation of the prostate, chronic prostatitis, and it will go up in age as you go up. And so many procedures are done without really needing to be done just because of the PSA. So it's really not a great screening test. A better test would be an ultrasound. Testosterone and mental decline. Low testosterone can cause loss of the ability to concentrate. It causes moodiness and emotionality, as mentioned previously. Great timidity, feeling weak, inner unrest, mental failure, passive attitudes, and reduced intellectual ability. I call that mental agility, the ability to go from one task to the other. That really is affected with low T. Dr. Jonathan Wright, who's the author of the book Maximize Your Vitality and Potency, he's reported this in his book. Testosterone in the heart, I mentioned previously. There are so many testosterone receptors in the heart muscle. There's more in the heart muscle than in the pelvic region, and there's even more testosterone receptors in the brain than there is in the pelvic region. So testosterone will help promote good blood flow to the coronary vessels, promotes vasodilatation so blood flow can be increased, and it helps to maintain healthy cholesterol levels. In China, doctors use testosterone to treat heart failure, and they use it intravenously. Several studies show men with high testosterone levels have less coronary artery disease blockages. Some studies show that when low levels are corrected, symptoms can improve by as much as 69%. So are you convinced yet? Testosterone to men is like milk to a baby. We need it. You can't walk around with a level less than 300. You're not going to have the same zeal that you once had. So, and don't expect it. You will have increased body fat and sarcopenia, and you won't have the energy and the vitality that you once had when you were in your 20s and your 30s. Here's what conventional treatment cardiologists, a typical cardiologist, this is what they do. For people with heart disease, the #1 killer, they use drugs. That's the conventional wisdom. They're trying to put an emphasis now. I've seen the recent stuff out since I'm getting ready to take my allopathic boards again. So they are encouraging more lifestyle changes, but the pharmaceutical industry has a real hold on medical education. And so we're taught as students and residents that when a person has a symptom, we immediately jump to a drug. Lipid-lowering drugs. The statin industry is several $billion per year, when very few people really need to be on statins. The antihypertensive medication industry, another $billion industry. Most people can treat hypertension with exercise, proper nutrition, weight loss, but that's too hard for people. We've been told that since we were in medical school. Lifestyle is hard. People don't want to do it. And there is also more effective nutraceuticals with less side effects. Hypoglycemic agents for diabetes, type 2 diabetes, which is clearly a lifestyle-induced disease, induced from stress and obesity. And now you have these anti-obesity drugs that people come in requesting phentermine or the newer agents, just so that they're telling you that they can't control themselves. So you need to give them a drug so they can control themselves from eating and eating the wrong foods. Anticoagulants. Now they have so many different ones now with the factor 9, factor 10, antithrombin factors. I mean, they're just to thin the blood. And they need that. Yes, someone has atrial fibrillation. I can recognize they will need something to thin their blood. But I will tell you, there are also a lot of natural stuff that will thin the blood in a very, very safe way. The newer agents, there is no antidote. It's not Coumadin anymore. The newer ones, you basically just have to support the patient if they have an acute bleed until the medication wears out of their system. Anti-inflammatories, tons of them, from aspirin on to all the non-steroidals and steroidals, and the biologicals they have now, the DMARD agents, quadrillion-dollar industries. And then obviously if the drugs fail, then they go to the surgical procedures. The rotor-rooter approach is what I call it. So now your vessels are blocked. So if it's in the heart, you do a cabbage, or you do an angioplasty and put stents in. If it's in the leg, you do a fempop, or you can put stents in. If it's in the neck, you do a carotid endarterectomy, or you put a stent in. All that prior to your cardiac catheterization to view what where the blockages are. Your angiogram with balloon dilatation. You can do that for the renal artery. You can do it for the brain now when you're having an acute stroke. And you definitely can do it in the aorta. Big money medicine is what I call it. We spend more money in this country on drugs and surgery, yet still, when you look at our health indicators, we are number 27 in life expectancy. And we spend over 50% of the drug dollar. Let's look at the integrative medicine approach. Lifestyle changes include stress reduction, nutritional supplementation, and physical activity is the crux of living longer. Mind-body medicine, spiritual meditation, relaxation technique, prayer and meditation, deep tissue massage and deep breathing, all very effective at lowering cortisol, lowering adrenaline, and lowering your blood pressure. You got to make sure your diet is well balanced and contains plenty of fiber, plenty of fruits, whole grains, vegetables, lean protein, and good fats like avocado and coconut and olive oil. Those are good fats. We have over 500 muscles in our body. And somehow people think they can just get up every day, go to work, sit around a computer, and then come back home, eat 3 meals a day, and don't expect to get fat or to become obese. 60% of Americans are overweight or obese. A walking, swimming, or other aerobic activity, as well as weight training, strength training activity, is very important. Both of them are important. Can't just walk. You have to do some strength training. You have to build your bones and your muscles. So in our office, we have a gym, and we have a personal trainer, and we have a massage therapist, and we have a chiropractor. And it's all about lifestyle. We have a nutritional program because we truly want to get people better. We want to get to the root cause. And hormone replacement is a part of that. And you need less hormone replacement the more you exercise. So let's get back to andropause. I had to take a detour there on the heart disease because, men die 10 years earlier of heart disease because they don't have the protective effect of estrogen in the earlier part of their life, and that wouldn't protect us anyway. It would probably cause us more problems. But a woman does catch up quite readily once she goes through menopause. So here's how I replace testosterone. The conventional way initially is to use androderm, which costs about $300 a month. And it's in two set dose. They have a 1%, which is 10 milligrams, and then they have a 5%, which is up to 50 milligrams. The testosterone creams, pellets, and sublingual tablets by the pharmacist comes in standard dose, which is one size fit all. They're expensive. Synthetic testosterone, such as danazol and oxandrolone, we don't use those because they actually go through the liver and can cause liver toxicity and liver cancer. There was a famous, I think he was a tight end. Was it a tight end or a linebacker, Lyle Alzado, who died of liver cancer, and that had to do with his injecting of anabolic steroids. Bioidentical hormone replacement. This is the way you do it. You want to use the same identical testosterone that your body is used to seeing. So it's structurally the same testosterone. No differences. It's compounded by pharmacists, and it's about a fifth as expensive. A month's supply costs about $50. And it's dosed individually. I can give you 10 milligrams, I can give you 20, 15, 25, whatever I choose, and it's compounded for you. And we can start slowly and increase it as we want. You can do weekly injections, you can do creams, gels. My preferred method is through subcutaneous pellets. I'm trained by Sotopelli. It's a physician organization that trains physicians to insert pellets subcutaneously. And they use only bioidentical testosterone pellets. The dose of the pellets is based on your weight and if you have comorbidities. So the heavier you are, is the more you're going to need. But if you have diabetes and heart disease, you're most likely going to need more as well. We put all that information in the software, and it tells us what you need. But the normal dose for replacement is between 20 and 100 milligrams per day. This is what you expect to see when you get on testosterone. It will improve your erectile dysfunction, your cognitive function, and your mood. Let me say a quick thing about ED. If someone smokes and they have serious atherosclerotic disease and the pudendal artery is blocked and they have aortic disease, their libido will go up with testosterone. Testosterone is not going to open up the blocked artery to all of a sudden give you an erection. It will improve the blood flow to the brain and reduce dementia and Alzheimer's, but you will need other things to increase your circulation. And I recommend arginine and citrulline and exercise to increase your circulation. You can use the DP4 and nitric oxide stimulants, things like Cialis and Viagra, but oftentimes those won't work as well when your circulation is that bad. So I always warn people. I said, if your circulation is bad, don't expect just because you get the pellets or you start taking shots that your erection is going to be where it was before. It's going to take time for you to improve your circulation, and the only way we know how to do that is through nutraceuticals of arginine and citrulline along with exercise. So testosterone replacement is going to improve the blood flow to the brain. It's going to reduce heart disease. It's going to reduce inflammation in the blood vessels. And it increases your coronary artery function. And it definitely improves heart failure. Low T has been associated with prostate cancer. So if your testosterone levels are high, it reduces the incidence of prostate cancer is lower in men with testosterone levels greater than 500, 600. I recommend replacing a man to between the levels of 600 and 1200 at the max. Now here are some nutraceuticals that help with boosting testosterone and suppressing estrogen levels. Chrysin is a natural bioflavonoid. It's isolated from virus plant and it inhibits aromatase. We normally use our chrysin mixed with testosterone creams or gels. So it's one whole preparation where I'd start someone with 50 milligrams of testosterone and then 25 to 50 milligrams of chrysin mixed in with it. So automatically I'm blocking the effects of aromatase immediately once they get it. For men that are getting the pellets, what I use is anastrozole. Most people know that as Arimidex, that's the brand name. But 1 milligram 3 times per week will block testosterone aromatization into estrogen. And I do that with all my men that are on pellets. The pellets will last anywhere between 6 months and 8 months. So they get their pellets and then they get on the anastrozole 3 times a week. There's another herb called nettle root. And nettle root prevents testosterone from binding to sex hormone binding globulin. Remember I mentioned before that the free testosterone is the active hormone, not the bounded up stuff. And estrogen tends to bind up the testosterone by producing more sex hormone binding globulin and obviously affecting the prostate as well. Now, DHT is dihydrotestosterone. That's been implicated in male pattern baldness, and it also has been implicated with prostate hypertrophy. It is 4 times more potent than testosterone. We don't need it to be that strong, so we actually try to block DHT formation because we don't want the prostate to swell, and we don't want to contribute to baldness. And the best thing to do that, nettle root will do that, but also saw palmetto blocks DHT formation because saw palmetto is a 5' alpha reductase inhibitor. And so most of my men then will be on saw palmetto. They'll be on the anastrozole as well when they get on pellets. Muropalma is another herb that has libido-enhancing effects in 2 clinical trials, and they found that it was better than yohimbe, Tongkat Ali, and Tributus, which are some other natural herbs. But Muropalma, if you look at, see this supplement, think of it as a herb that increases the libido because it actually helps with testosterone levels. So in conclusion, andropause is not a normal state. You know, andropause is the reduction of testosterone produced in the testicles. And it can be treated. When you treat it, you slow the aging process. I can't tell you how many patients that I've treated who they just don't look their age anymore. They have better posture because of their muscle structure is improved, their bone structure is improved, they have mental agility. So it increases your body composition. It's great for treating heart disease, strengthens your heart, improves your sexual function. It definitely improves your libido and may increase your ED as well, depending on if you have no risk factors, like if you don't smoke or you don't have diabetes or hypertension, it will definitely increase your ED. But if you have those, then the effects on ED may not be as strong as indicated. So bioidentical hormones is a safe and effective alternative to synthetic hormones. Compounded pharmacy should be viewed as a low-cost option to the FDA-approved synthetic medication. And here are my locations. I have 2 locations in Atlanta, Georgia, one in Hateville and one in Tucker. And this is where we do our integrative medicine, anti-aging, and functional medicine. We also do pediatrics, internal medicine, chiropractic and physical therapy, podiatry, gastrointestinal medicine, and our newest program is called 8 Weeks to Wellness, where we actually get people to sign up for a lifestyle changing program, which includes massage, exercise, meditation, chiropractic, and nutritional therapy. So that is the presentation in Andropause. Hope your audience enjoyed it, and I'll entertain any questions you may have.
Thanks, Dr. Christie, for this excellent presentation. Very informative, like for testosterone for ourselves. And the few questions I got is like, let's say people want to start on this pellet insertion therapy. Like, how long this procedure takes, and like, is it something that we should be scared, or is it a very easy procedure?
Yeah, it's a very easy procedure, Dr. Salid. You know, we prep the area, and the area is usually right alongside the buttocks, so you're not sitting on it. It's towards the side, and then we inject a little lidocaine, and with a trocar, we then insert the pellet. The total procedure takes about 15 minutes, and people are in and out. We have them to ice it for about a day, off and on for 5 minutes, and then it's over. There's no side effects of the procedure. There's no chance of infection. There's no suturing involved because the pellets are pushed in through a tiny little incision that we make, and it's then a Steri-Strip is applied just to keep it closed for 48 hours, and then it heals up on its own.
So they can get back the same day to work?
They can get what?
So they can get back to work the same day?
Oh yeah, they go to work the same day.
Okay.
Yeah, they go to work the same day. The only thing we tell them not to do is to go run a marathon, because the muscle and your glutes could actually, if you're exercising vigorously for those 2 days, you can push the pellets out. So you wouldn't want to do that. So we tell them no vigorous whole body workout, but you can go about your daily activity. You go to work. You can actually do upper body work if you're working out, and it's a simple procedure. You don't need to take a day off work for this.
Wonderful. Dr. Bennett, any questions?
Yes, thank you, Dr. Christie, for another clear, easily understood. Those slides are excellent. Just a couple of questions. A couple of things I was surprised at. An annual ultrasound after the age of 40 for men. Is that a relatively new suggestion?
Well, I think 40 is a little early, but I think if you have prostate cancer that runs in your family,
Okay.
When you look at the other screening tests, some of them are just way too expensive. And I think if you do a digital rectal exam, and if you feel anything at all, that's when I would go on and do the ultrasound. But definitely over 50, I think ultrasounds are warranted.
At what age would you suggest a man being tested, his testosterone level checked, or is it kind of like a case-by-case?
If anyone presents with fatigue in your office, they should be tested for it. Because the youngest person I have right now that I'm treating for low T is 32 years old. I do it routinely on all men over the age of 40. They get a testosterone checked with their annual, just like I check a vitamin D on everyone, I check a testosterone if they're over 40.
Do you ever prescribe testosterone to someone that has a normal testosterone level?
Well, it depends on what you mean normal, because I don't just treat a number.
Okay.
The lab value of normal is 240 to 1100. Many men will come in with symptoms of low T, and they're 400, 450. Usually, they're not over 500. So there's this gap here between 240 and 500, where people are functionally low T. Those people are treated. My level of cutoff is between 500 and 1200. And so, yeah, if their level is between 240 and 500 and they have signs and symptoms of low T, you're being treated.
Okay, thank you.
Yeah.
Thank you, Dr. Christie, again.
Okay, I hope it's been informative. Now, I wanted to say that I have patients all over the country. I have patients in California, I have patients in Florida, I have patients in Canada, and I just picked up 2 new patients, one in Barbados and one in the Virgin Islands. So I do phone consultations if anyone is interested in that. They can just call one of the numbers on the screen and set up a teleconference. So you don't have to be here. We can order the blood work, order the saliva test, whatever test we want to use, and so that patients can get access to this. And we'll ship the creams and the gels anywhere. Obviously, if they want the pellets, they would have to come into the office for that.
Very good. Thank you very much, Doctor.
You're welcome, Dr. Bennett.
Okay. We'll be back hopefully with more from Dr. Christie in the future. Thank you very much.
Perfect. Thanks.
You're welcome.